Okay, you're all set. Thanks.
Welcome to the finance meeting for Thursday, January 13th. Our first agenda item is approval of the minutes from the December 16th meeting.
Move to approve.
I'm sorry, what'd you say, Bill?
So move to approve.
Oh, second, sorry.
Any discussion? Seeing none, all those in favor?
Aye.
Motion carries 3-0. Update on the ARPA final rules.
Okay, you found in your handout a summary of the new final rule. We've been functioning on the interim rule since early 2021. So now we have the final rule, and I don't know if everybody read it or even read the 400-page version, but I will just say the highlights is for us, it was extremely good news. Especially on the newest item being the replacing lost public sector revenue. So in our case, we were running the test to see if there was lost revenue, and using the 2019 as our base year, and they were using calendar year several times. As you know, as often as we try to calculate, there really wasn't a loss. We had a year where we had an increase in a budget that was just making it not work, which was giving us kind of that, not the flexibility we wanted. With this new final rule stating that they're giving a standard allowance of the $10 million, that is basically our full amount. We have the 5.9 for our total allowance, and that leaves us the, I would actually call it the freedom to use those funds as if we would use it in our normal budgeting process. So those things that we would use in a normal budget process would be eligible. In addition to that allowance, it also comes with streamlined reporting requirements, which is always a good thing. So that was the greatest advantage. If you got anything out of all of this documentation, was the best highlight of all. Other highlights within it, talking about the public health and economic impact section in there. They are including capital expenditures. So if we decided to go outside of that streamlined portion of the $10 million, there's other things, such as what we have done with the small business grants. There's also things we could do with capital expenditures. They've also done something as far as identifying the groups that we could address. There was concern in the definition of who we would be addressing, whether it be those groups that were disproportionate or what is impacted. So that leaves us the a wider range that we can address those people within the town of Rocky Hill, rather than saying we have to identify those that are disproportionate. It's just impacted within the COVID, which is a broader definition. Other highlight being for premium pay. As we know, we did that with our firefighters and ambulance, but they've broadened that if we were interested to eligible workers. So anyone that's within the government would be eligible. There's also some caveats within pay. If we wanted to examine that, that's within the 400 pages if we wanted to go deeper. Other than that, this is in effect for April 1. They're allowing us to make it effective today if we wanted to. There's nothing wrong with starting early as far as they're concerned, which was great news as well. And again, this is going anything obligated through December 2024 and expended through December 2026. So they haven't changed the time frame. This is still the full 5.9 going out to 2026. So that's 400 pages in a 5-minute nutshell.
I appreciate the cliff notes.
So any questions? I've gone through the webinar and done some more in-depth reading, and I'll entertain questions or anything you'd like to look deeper into we could research.
Yeah,
Sure.
I have a couple. So one of the focus there was on the availability of these funds, to the town for, for traditional municipal functions, capital projects, whatever. So what options are there here, if any, for getting some of these funds into the hands of town residents who are experiencing financial hardship related to COVID?
There are actually a great bit of a option in that, because as they're saying now, it's those that are impacted.
Right.
And whereas before it was saying disproportionate. So as long as we can identify that the impact is there, I'll give the example again, what we had done with the small businesses, that we had determined that the small businesses, when they come forward and say, yes, we showed that we had a loss. So if the impact is determined, then the outreach is available for us to do.
So, yeah, and I can understand that through businesses that there's already mechanisms in place for them to apply for grants and the like. But how about, how do you get from the funds coming into the town to a process of getting support into the hands of just individual, residents who need assistance? So not necessarily through a business, but to an individual. So I'll give you an example. So you have families say that when the schools are closed because of COVID related reasons, you sometimes have a parent who's forced to stay home with the child and may lose pay at work. They've exhausted whatever pay time, if any, that they have. And so there's direct financial hardship tied to the pandemic related disruptions, to an individual. It's not a business owner, it's not a small business, but it's a household financial loss. Is there a mechanism in place or that needs to be put together to try to address that type of situation?
Bill, I don't think there's anything in place at the town level.
Okay.
Except maybe coming into human services
Exactly.
and expressing some concerns like that.
Yeah.
I think there may be some various state programs that may have been in place for the past couple of years that they could apply for. A lot of it's based on income, salary guidelines and so on. But as far as from a town standpoint, I think it would be more someone coming in and expressing some concerns, needs through human services, and something could be provided through them.
Right.
That's about the only thing I could think of that's in place right now.
All right. So we're not talking anything that was set up or that's specific to COVID or to this or to this funding. It's through the existing channels, through human resources,
Right.
Or social services rather.
The food pantry and
Yep.
That type of items, but
Yeah, I mean, I think what I'm talking about is something a little bit different, though.
but I don't think that's in place.
But so
You're thinking
if it's not in place right now, so I guess, so my question is that something that we're considering? We have a considerable amount of money we're talking about here, and I guess I'd like to get some sense. Maybe it's premature. It's probably going to be a process to figure it out what type of priorities that we should be looking to put that money toward. But I was thinking, specifically at kind of the family and household level and individual resident level, what we can be doing, and starting philosophically, is that the sort of thing that this money is intended to address, or is it intended for something else?
Yeah. Well, I would say definitely it's what it's intended to address. One of the many things that'd be eligible, but as John said, as the departments that we have, if we were, identifying that was a need and the funding was identified, we had put an amount into our human service department to look into some of their services and expanding if it was a program that we said, this is where we'd like you to focus, and funded that. And that was the purpose. So as he said, that would be the route to take, and we could give it a different purpose addressing other eligible groups. So I guess we have that.
So Mr.
freedom.
Chairman Greenspan, I just wonder if it might make sense at the full town council level to be thinking in terms of whether a subcommittee or some type of agenda item for us as a full council to be, thinking about, obviously, working closely with town staff, but to identify priorities for, where this money, where the need is, where it can be allocated, and what type of, systems and need to put in place to disperse it.
And Bill, I'll address it here just a little bit. We do have a standing agenda item on our council agenda for anybody on the council to discuss options for uses of ARP funds.
Yep.
And it's, as you know, the last couple of meetings, we've been kind of adding and going through as need requests have come. Also, just to kind of comment on the need directly to families. During COVID for the last 2 years, it expired somewhere in 2021. There was the Family First program that anybody that was employed was eligible to be paid by their employer, and even though they were out sick, and the employer was reimbursed by FICA funds, by a credit to their FICA funds.
Yep.
So hopefully people were able to utilize that. And of course, unemployment programs were extended. There's a lot of things that went. It doesn't mean there's not people with needs by any means. But where I'd kind of be looking a little bit right now is, I'll say 3 months ago, 4 months ago, I kind of thought COVID had kind of disappeared and we were on that road to recovery. And then the Omicron variant came out, and it seems like we have more people infected now than ever before. And none of those programs are in place, right? So if you're out sick now, you're not getting paid unless you have PTO time or your employer offers paid sick leave.
Right.
So I guess the challenge becomes we're still dealing with I'm going to call it the first round of COVID, and what we're trying to address, the mental health issues, both at the school and as well as at the senior component. Our human services food bank has been very well stocked. So that's been a very positive point. Our communities contributed. We've donated money. They've had some very successful fundraisers. So we're kind of addressing that. But now we hit, step 2, where we're back where we were again, 30% or 20% positivity rates. We never saw that before.
Right.
So
And some of those earlier programs are no longer in place. That's the thing.
Yeah. I mean, the honest answer, or the concern, I guess I'd express, is the amount of money we have, even though $10 million sounds like a lot of money, divide that by 20,000 residents.
Well,
plus
sure.
already spent it. It just doesn't go far enough to figure out how to distribute it, nor does the town have the resources or mechanism to kind of handle that. Just doing the small business program, we have not had a great response to the number of businesses that have applied. But if we had 100 businesses apply, I'm not sure the staff of 3 that are reviewing the applications could keep up with their full-time day job. So I don't know how to put a mechanism in place when we're a relatively small staff. But if there's ideas, I would definitely bring them up at our council meeting, because maybe we come up with solutions.
Yeah, I mean, I don't think the idea is to just take this money as a win, in effect as a windfall and use it to pay for things that we're going to pay for anyway from regular tax revenues. I mean, collections look like they're going pretty strong anyway, but this is supposed to be emergency relief for people dealing with the dislocations from this crisis right now, and giving money away intelligently, I mean, is hard. You really have to put processes in place, because you're right. The quick math is 20,000 divided into 10 million. That's easy.
Just to clarify, it's not 10 million. What is
It's
it,
the
Mona?
5.9.
5.9.
Whatever our share was, right?
That math is a little bit harder, but
I'd say
that's
5.9 with about, actually, we're down to about 3.7 because we've already used a portion of it, unfortunately. So.
okay. But the example I gave, the specific example of people suffering, wage loss because of their children forced to stay from home. Obviously, you put guidelines around that, eligibility requirements, our process, and to the extent that there isn't enough staff to implement something like that, you could use, I suppose, some of the funds to, on a contract basis, hire the staff to run it. So you can kind of get past that chicken and egg if there's a commitment to do so. But it's for a lot of people, it's an emergency situation. It's urgent. The need is right now. And it's for some people, it's a matter of creating a system that gets them financial relief, as soon as possible. So I guess that's fodder for, as you suggested, Alan, a conversation at council next week.
Yeah, definitely. And I think it's going to be a standing agenda item.
Yep.
Ongoing, and until this is probably the 2024 until we expend it all.
Yep.
Mona, what's the timing of the second tranche at this point? Do we know?
Yeah, well, last I had heard was that it's supposed to be 1 year after the receipt of the first, which was the end of June of 21. So we could be looking at another 6 months or so.
And nothing in this changes the timing of that earlier or later. It's, as far as you know, it's the same. Okay.
Correct. Yeah, it should just be the second tranche coming like in the 6 months or so, and still the same time frame through 2024, expended by 2026. So obligated by 2024, expended by 2026.
So between now and you kind of alluded to the numbers a little bit. So you say we have 3.7 left. So of the 2.9 from the first tranche, we've used about 2.1 is spoken for.
Right. There's about 800,000 remaining. Right.
So we got to kind of keep that in mind as we want to create programs that the 3.7, 2.9 of it we don't get till June. So just keep the timing aspect in mind.
Yep.
Cash flow.
Yeah.
And just along those lines, I mean, and trying to address the current need now, and I know the state and federal government tried to provide test kits, and they seem to be in short supply. Do we have any resources that maybe the town can buy and distribute test kits, or if we don't have enough N95 masks, or is that something that we can't even get our hands on if we had the financial resources?
I think right now, as you say, it'd be difficult to get our hands on it, but it may be something down the road that, depending on the supply chain and manufacturers, we may have an opportunity. But Steve, the emergency management director, does contact with our Region 3 coordinator, and he pretty much says they don't have anything available at the moment, any extra stuff to hand on. So it's probably an idea we could implement a few weeks down the road. As the supply.
I think test kits starting like next week are, I think, at no cost to individuals based on your insurance, or there's a new rules going to effect, I think, next week about this, where again, the problem is going to be if you can actually find them, but it shouldn't be a monetary issue because they shouldn't really be at cost to anybody. Is anybody else aware of that? I read something about that the other day.
Well, I think the federal government is buying a lot of it. And the focus has been going down to the schools at this point. But then the government is supposed to be developing some sort of app or website that people can go on and order these kits, and they, I guess, would get delivered to them as well. So I'd assume that's the federal plan down the road, which would be, multi-states and so on. So
but I think there's
I just
also
think a lot of people are looking for it and it's not available.
Right. I think there's also part of that if you have private health insurance, if your employer would have you, that they have to cut, like if you go to CVS and find them and buy them, they will cover that, and then probably the government's reimbursing the insurance companies, I'm guessing, or something along those lines. So it shouldn't be, it's a supply issue. Shouldn't be a financial issue for anybody, is what I'm saying. So
yeah. Okay, I agree.
And we could discuss that further on Tuesday night if there's other ideas or thoughts, obviously. If there's nothing further on that, we'll move forward to item 3, update reserve for capital and non-recurring expenditures. And just so everybody knows, there is nothing in the packet because I've gone through it 6 or 7 times and Mona to double check.
I couldn't find it. Huh?
It's not in
Like,
there.
where's Waldo?
Yeah.
Well, we can provide a copy Monday night on the table, but really not much went on in the non-reoccurring in December. So pretty much everything stayed the same from the end of November balance, where we're going to be, shuffling some money around. our venture with Newington to buy the lawnmower. And that's still to be done. But other than that, nothing really occurred in that fund in December.
Okay. Then we'll move forward to item 4, state aid to municipalities.
Okay, only one highlight on that page, and that would be our payment that came in for the Mashantucket Pequot that we received in December for $71,182. That's what was received. That was what was expected. So nothing unusual and nothing off track in state revenue.
Okay. I assume there's no questions on that, so we'll just move forward to 5, our monthly financial report.
Okay. So first report we'll have is on the tax collections. And as you can see, we're definitely on track, actually a little ahead in comparison. Oops, give me a second. I just lost my page. At 66%. Last year it was at 67. But if you see the benchmark again, that's encompassed into a 3-year average. We're about 1.7 million ahead. Obviously, that's can be something that will fluctuate as we go into January. That tends to be a variation of where the end of December occurs. December, January tends to fluctuate a bit, even if we try to put it on that benchmark average of the 3 years. But being in that 66 to 67% range is really where we should be through the month of December.
Why don't we keep going through it, Mona?
I will.
And we'll just do
Okay,
questions if we got them.
Okay, that sounds good. On all other revenues, they're basically the ones to point out. I think we're on track with recording fees as well as the conveyance and building permits, which tend to be in their 40s to 50%, which should be where we would like to be through the month of December. And as usual, we are on the low end of interest at 8%. As far as the miscellaneous revenues at 89, I think I'd mentioned before that we received our KERMA distribution earlier in the year. So that should basically stay the same and just turn out to 100% toward year end. Okay.
Kind of encouraging is our building fees. We're already at 50%. Usually it's
It
a
is.
lagger that usually picks up in the spring.
Mm-hmm.
And the conveyance tax is pretty solid too.
They are.
Below 50, but still doing well.
It's great news.
No.
On the interest on investments, is this just a matter of are we just think we're going to get more than should we be budgeting less for that, or because rates are not very high, obviously, so.
Yeah, actually, I think that I was looking at last year, we had budgeted 280, and I thought when we had cut that budget line item dramatically down to the hundreds, that was so aggressive, perhaps being a little more optimistic with the world. So you're right, coming into this next budget season, I think we're just really going to have to dramatically cut that. I don't see any light at the end of the tunnel at this point.
Right.
Okay. If there's no other questions on revenue, we'll move on to the expense side.
Sure. And, as for expenditures through December, nothing I think that I would point out. I noticed we had the 60% under the town manager. He really is a journal entry that needs to be posted there. That's a salary that belongs to the senior department. So there's a correction there. That salary line is truly not that high. So that's something we need to fix internally. I'd also point out that the police patrol, about halfway through the page, is at 47%, which is a bit on the low side. And that's more of a situation of vacant positions and turnover, but at this time they're fully staffed. So we'll see that start to balance itself out. I'll point to the that senior programs, that being the 34%. Of course, we'll make that correction on a salary line, but also beginning programs, and they're starting to pick up. So we'll see that adjust itself for year end as well. Education, that's at 25%. At the time of the report, we had not received their November expenditures, so we're still looking at that number through October that was reported at the last month. And as far as our capital improvement, both the school projects as well as town road aid still unexpended, but we'll probably see that occur during the end of the year.
Anyone have any questions?
Just a couple. There's a couple fire department lines in the ambulance line that are in the 20s or 30%. Is there just some timing things going on there, or?
Exactly, yeah. Timing things. They tend to do some things quarterly as well.
Gotcha.
They will be behind a bit on the training, but we've had discussions about what their plans will be on that. So there'll be some delay and also some timing situations.
Thanks.
Any other questions?
Nope.
Seeing none, do we have anything under other?
We
Two
do.
items.
Go ahead, John.
Yeah, I think we may have seen in your, hopefully delivered at your homes, we had the audit report package delivered. So we had our state and single audit in that, as well as our CAFR. And we'll be having at our next finance committee meeting, we'll have our auditor come out and do a presentation and discuss that in a little more detail. We also received our bond rating still at the AA+. So we'll be putting that report out on the table at the council meeting. They wanted us to hold up a bit. They like to take their time and make sure everything is dotted and crossed and before they present that. So we'll have that on the table for you on Tuesday. But a very complimentary report, keeping the same rating. It's, very complimentary on our economic base and our
Financial
budgetary
management,
performance. Pardon me?
a strong
So, very good.
financial management,
It was very
That was a
good.
commercial.
conservative
That was a commercial.
budgeting.
They loved us.
Doesn't he get a sticker every year?
We blacked out anything negative on the report.
Redacted, I like that.
But, so there, we wrapped up our rating agency call and report. And as Mona said, we held a AA+. And then tomorrow, we have to do a due diligence call with I guess the financial company that is doing the refunding deal. So we have that coming up, and then hopefully this whole thing closes out the last week of January, and we get our refunding done where we could see $1 million plus refunding savings.
Savings.
And I'm assuming that $1 million plus savings was related to us maintaining our AA+ rating. So that
Definitely.
plays into that whole package.
Also, this one could be impacted by the market conditions as well.
Yep.
Depending on what the rates are going at the day that we do our transaction. So there is some outside risk associated with the market.
Any questions based on those two items? No.
None here.
Seeing none, I'll entertain a motion to adjourn.
So moved.
Second.
All those in favor?
Aye.
We'll see everybody on Tuesday.
Good night, all.
Okay,
Good night.
thank you.
Good night.
Good night.